And I think in the same, I guess, with the same topic, there's a lot of pressure for extracurriculars, whether that's, having a job is not an extracurricular, but working versus research versus community service versus other things you do to socialize and whatnot. But then you have studying, and at high school, undergrad, and now medical school level. So how do you balance extracurriculars and your education? What's the priority supposed to be?
I think if you can double dip, you really should do your best. And I guess I'm talking more on the undergraduate level at this point. So, obviously, undergraduate education is expensive and you're going to want money to do things. And then, if you want to go to graduate school, that's also expensive. So, for example, one thing that you're supposed to do is get clinical exposure, and a lot of people do that by shadowing. But if there's a way that you can get those hours by actually working in the medical center, so maybe that's being a tech in the ED or a scribe, then that way you're actually seeing things, but you're also getting paid for it. So that's one way.
I think it's very important, just when you're trying to apply to medical school, you need to be involved in extracurriculars. It's just something that you have to do. You have to do some type of research or be involved in some type of summer program. You have to have volunteering and service because you're going to be a physician, and that's what our job is. But there's also a social piece as well, because you want to have fun people that you work with. And so I think it's just important to really work on that in the undergraduate setting. I think there's not nearly enough time in med school to kind of do all those things, and you really have to be intentional with what you do. But I think in your undergraduate education, there's a lot of time to do those things and really build your resume up, so that once you get to med school, you're not spending time thinking oh, I have to get community service, or I've never done research before. I think it's really important to get your feet wet at that stage in your education.
I think something to keep in mind also, though, is that at the end of the day, when you think of a physician, you want them to be well-rounded. And so you're a physician in the making, even at the high school level. I'm sure we all wanted to be physicians in high school. So we had that mindset even then, but you can't allow the extracurricular things to get in the way of the work. I think, you have to have the balance. So if something is too much for you and it's taking you away from doing well in your coursework, then you need to be able to just put it down. Assessing, what the priority is, basically.
Yeah, I would also add that as often as you can combine things, that's also great. For example, if you're part of a scholarship program, they might have, an ambassador piece associated with that. And so as a scholar, you might be asked to go and talk with alumni, or go and try to recruit other scholars, or go and meet donors. So those are kind of building your volunteer hours, that's building your leadership skills. So knowing where you can kind of fit in and kind of gain new skills and what you're bringing to the table from these extracurriculars is important. I also think that a lot of the time we talk about following your passion for your interests. So for example, if you want to do community work, you should be doing it with the community that you care about. Maybe that's your local community. Maybe that's your undergrad community. Maybe that's high school students in the area that you're working in, because you're really passionate about trying to get them to their career. So just kind of following the trend of what you like to do and where you like to be in the spaces you like to occupy. If you're really passionate about it, then that can kind of also be shown through your extracurriculars as well.
I think you brought something up about actually trying to get those leadership opportunities, and I think this both goes for undergraduate students who are trying to go to medical school, as well as even high school students who are trying to go to college. So, oftentimes I think people are always saying, yes, 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 I will do anything that you want me to do. You're getting stretched into a million directions, and that's really bad, and it's taxing on your mental health. And I think it's so important, like Iviana was saying, to just find something you love and dive into it deeply. That way, you know, when you do have a couple hours, you're one, excited to spend time doing it, and that you can really just get so much more experience and talk about it with such passion when you are in an interview or writing an application.